My background is in nursing, and I currently work for an organisation called Life Circle Australia. In a 3-year period recently, my father, my mother and my 41-year-old sister all died, and I was involved to a greater or lesser extent in their care. And palliative care actually was involved as well in some of those situations. In my background as a nurse, and also the work that I've done more recently in patient experience and consumer engagement, I saw firsthand importance and significance of the consumer voice being at the table, and people who are developing policy and driving change in the healthcare system needing that really firsthand on the front line experience and how that policy, the implementation of that policy affects them. People are very frightened by palliative care. It's almost as if they feel that everyone's giving up hope. It's the last ditch service that's being offered to them. So people really see it as a loss. The period leading up to that time can be one of great intimacy, great communication, great fun. So I think it would be great if palliative care in some way could try and change that community perception. People assume that the people around them will know what they want, and I think it's a very difficult position to be put in, to have to speak on someone else's behalf if you haven't had those conversations. If we were all a little more comfortable with death and dying and understood that it may not be the terrifying experience that in the way that it's sometimes portrayed, that would be a great thing.